everyone, I am Nuzhat Batt from Jalal-Abad State Medical University, presenting the topic chronic pielonephritis. Chronic pielonephritis is a condition characterized by irreversible and progressive glomerular and tubulointerstitial fibrosis, ultimately leading to reduction in GFR and retention of uremic toxins. It occurs due to recurrent inflammation and scarring. In these images, we can appreciate gross anatomical changes like small and shrunken kidney showing unequal contractions at various places, the scar, blunted calluses, addition of capsules or kidney cortex, and histological changes like atrophy of the tubule and dilation, periglomerular fibrosis, chronic inflammatory cell infiltrates in the interstitium, thyroidization of the tubules. Moving to etiopathogenesis, depending upon the etiology and pathogenesis, we have reflux nephropathy and chronic obstructive pyelonephritis. Reflux nephropathy in vesicoureteral reflux or VUR, urine is flowing back from the bladder to the kidneys, resulting in infection of peripheral papillae and consequent scarring of poles. Grades from 1 to 5 are given depending on the severity of the reflux. It manifests in early childhood. The incidence of reflux is same in infancy, but after infancy it's more common in females. Then chronic obstructive pyelonephritis. Obstruction to outflow of urine at different levels predisposes the kidney to infection of all the papillae and diffuse scarring of kidney and thinning of cortex, as we can see in the image. This condition can be bilateral or unilateral. Other additive factors are bacterial infection, viral infections such as hepatitis B, hepatitis C, and AIDS, autoimmune disorders like SLE or other causes of vasculitis. The antigen-antibody complexes formed due to streptococcal infections gets deposited in the glomerular capillary walls, causing polymorpholeukocytic infiltration, leads to damage of capillary walls, including the glomerular basal lamina. Chronic glomerulonephritis is the commonest cause of end-stage renal disease. The incidence of this disease is seen more often in infants and young children, children with congenital anomalies of urogenital system, person with flaccid bladder due to spine injury. Coming to signs and symptoms, on examination we can see edema of face, eyes, legs or abdomen, low-grade fever, headache, hypertension, hematuria, proteinuria, flank pain, cough and diarrhea, muscle twitching, joint ache, loss of appetite, dysuria, and newborns can show non-specific symptoms like poor feeding, irritability, jaundice and weight loss. What are the predisposing factors? Factors that may affect the pathogenesis of chronic pyelonephritis are the sex of the patient, more common in females than in males, pregnancy which may lead to progression of renal injury with loss of renal function, chronic bladder infection, recurrent UTI, neurogenic bladder dysfunction, instrumental intervention like use of catheter, tubes, speculum or other surgical procedures. Diagnosis: urine analysis, positive leukocyte esterase test, pyuria, hematuria, WBC casts are seen. GFR is reduced, albumin creatinine ratio is increased more than 220 mg per millimoles, blood test, anemia and neutrophilia is seen, imaging tests like USG CT scan, kidney biopsy and intravenous pyelogram is done. What are the complications associated with it? Proteinuria, focal glomerulosclerosis, papillary necrosis, perinephric abscess. Then to treatment approach. Prevent recurring febrile UTI, prevent renal injury, start antibiotic therapy, amoxicillin, trimethoprim or nitrofurantoin. ACE inhibitors or angiotensin II receptor antagonists are given, analgesics, and then call for follow-ups. Lifestyle modification, increased fluid intake and other dietary changes are offered. Thank you.